So with the second wave of COVID-19 behind the Western Cape now, there are significant decreases in the number of new cases, hospitalizations and deaths. But health authorities have noted an increase in trauma cases, most of them alcohol-related, as Ayesha Ismail reports now.
Every time there's a relaxation of alcohol restrictions, trauma cases increase, sometimes by more than 100%. This is what Western Cape health authorities have been observing since last year. They say while they are pleased about the drop in COVID-19 infections, they are concerned about the rise in trauma cases and are hoping the alcohol restrictions over the Easter weekend will relieve the pressure on trauma units.
What we expect is a plateauing of those cases over Easter. We're not expecting a massive drop of the cases over Easter, but we definitely expect an impact, and it's more of a blunting impact in terms of where we would have had high spikes, that it will be slightly lower and blunted.
Kluti says in the meantime they have been informed about new COVID-19 cases in the Cape Metro.
The increased cases in the Metro, we are watching very carefully to try and understand whether these cases are actually the start of a cluster that could potentially trigger bigger clusters. We've not picked up specific clusters, but it doesn't mean that over this weekend or early into next week that it cannot develop into clusters.
Kluti says they want to delay the onset of the third wave so that it does not happen in early April.
If we could manage to delay it into May, it gives us a better chance because then the vaccine administration also takes off. If we can vaccinate people over the age of 60, and we can get significant amount of people vaccinated over the age of 60 before we start peaking into a third wave, we will make a big impact in terms of the most vulnerable for people for severe disease that will require hospitalization and oxygen.
But this can only be done if people observe all the COVID-19 protocols. Ayesha Ismail, Cape Town.